Hi guys, thank you for checking out our YouTube channel and watching this video. My name is Dr. Kaete Archer. I'm a facial plastic surgeon in Melbourne, Florida. The video is about one of our patients and her story. Her name is Lenore, and she has Maitland's disease. This is a genetic condition causing large fatty tumor growths in the upper part of the body, mostly across the trunk, the back, the shoulders, and on her, she has large ones in front of her ears and around her neck, which is the reason why she came to see us in the office. The issue that you run into with Lenore's story is because her condition is so rare, it was very difficult to work with her insurance companies to explain why the surgery we were proposing to remove these fatty tumors, lipomas, was related to functional issues, pain, restriction of limitation on her neck, etc. And we ended up offering her a big surprise in our surgery center.
Hi, my name is Lenore Shimilewski. I live in Melbourne Beach, and I am a flight attendant with Southwest Airlines.
Hi Lenore, how are you? It's Dr. Archer calling. Yeah, I'm doing well, thank you. How are things going? Good, good. I wanted to update you on the status of the case we've been working on. I know that we've been going back and forth with the insurance company, and it's been an ordeal to try to get this all worked out for you. I know it's really important to you to have it done through insurance because of different situations. Amy mentioned that the lipomas on the back of the neck have even grown since we saw you last. Yeah, and they're pretty painful, huh? So we were putting our heads together, and we would like to surprise you with something. Yes. We'd like to offer to do the surgery for you in our cosmetic surgery center at Riverview. And we'd like to do that for you as a gift, free of charge and complimentary, for all of the fees. Yeah, no, I'm serious. Thank you. Well, we're honored to do it. We're grateful to do it. Hi, everyone. We are here with my friend Lenore. Lenore, thank you again for being willing to share your story and talk with us today.
Well, thank you for having me.
You're welcome. I'd like to start by hearing about the first signs of your condition. Changes in your body, growth of the fatty deposits. What was going on before the doctors really knew what was causing all of these changes?
Well, in '05, at the top of my shoulders, it just kept getting bigger and bigger, and when I would ask doctors about it, most of them would just say, "Oh, you're just built like that." Mm-hmm. Well, it just kept getting larger, and finally, and my gynecologist at the time actually said, "Yeah, that's definitely not right," and she sent me to get an MRI, mm-hmm. and it came back as a tumor, and then from there I had that removed, mm-hmm. but still no diagnosis or reasoning for that being there. And then in 2015, it formed again in the same spot. But when I went to see the plastic surgeon for the consultation, I walked in his office and he looked at me and said, "Oh my God, you have Maitland's disease." And I was clueless, and everybody else was clueless as to what that was. And he showed me pictures of people on the internet that had it. And at that time, none of the characteristics on my face and neck were showing. Yeah. But I've always been broad-shouldered and have a bit of an athletic build, and that is one of the characteristics, is a pseudo-athletic build. And in the last 2 years since that tumor was removed in 15, all the face characteristics have started showing up with the excessive fat under my chin, and it's not symmetrical, it's more on the left side. Mm-hmm. And fatty growths on the back of my head. They think they call it a collar. Mm-hmm. I've gotten the collar. And excessive growth in tumors in the trunk. So it's weird. It's like God put two different people together from here up. From here up, especially in the back, there's the pseudo-athletic build. If you look at my back, it's very broad and wide and just not the same as the rest of me. And it causes pretty much pain and discomfort. It's grown on the back of my head, like where my skull meets my neck, and it's like carrying around weights on the back of your head a lot.
Very heavy.
Yes, and this on top of that muscle right there is heavy, and it's hard to hold your neck up sometimes.
Tell us how they arrived at the diagnosis. Was there a test that you had to confirm his suspicion, or is it usually just based on the physical findings?
It's usually it's usually based from what I understand in the research I've done, based on just a diagnosis from a doctor. Yeah, there's not a test. Okay. And that was one of the things that they said at the Mayo Clinic. I saw a genealogist, and he said that, sorry, but they haven't discovered the gene that is mutated or that causes this to happen. And they don't know how to, the treatment pretty much is surgery, liposuction and removal.
Right. And that's the condition itself, even though when you remove the fatty tumors and fatty growths, there's always that risk of them growing back because it doesn't cure the condition per se. So this patients who have the disease, the condition is always a part of you. It always has the risk of growing these new fatty tumors back.
Yes.
Is that what you understand as well?
Yes, definitely, which is not exciting at all. Right. But that is why I went to the Mayo Clinic. And I'm still doing research because I want to find preventative measures, Right. It's always going to be there from what they know, and it may or may not grow back in the same places. As of now, I don't have another large tumor on my shoulders anymore, but I do have other growths back there, and all this is new. But if there was something I could do, nutrition wise or anything, I would do it.
We ran into a very frustrating situation with Lenore's insurance because all of these changes are related to her underlying condition, and unfortunately, despite multiple phone calls and explanations of it, maybe because it is more of a rare genetic condition that we don't have a lot of research on, and we were very honored to offer Lenore surgical options, both to improve the functionality and the restrictions that she has from those fatty tumors and improve the cosmetic appearance at the same time, by essentially doing a facelift, neck lift kind of a procedure with incisions that are camouflaged around the ears that allow us to access this whole area in front of the ears and from behind the ear and the hairline down into the neck to sort of sculpt that area. We realize that the condition obviously continues, the fatty tumors can come back, but I think that being able to get them down to a more manageable level will make a really big impact in both how you see yourself and your day-to-day activities.
Definitely. It's going to make a huge difference in how I feel. Because I don't think anybody realizes how stressful and tiring it is when you are in constant pain or discomfort, And it is not fun to look in the mirror and see things that weren't even there 2 years ago. We all age, but this is on a whole different level.
I wouldn't have been able to advance my knowledge if you hadn't had the courage in a way to come to the office and be willing to accept another I can't help you kind of a result, which I think can be very disheartening.
It is.
In a way.
That's the word, disheartening. Yeah, for sure. And that's why I'm just so grateful that I'm actually finally getting to move on and with some sort of treatment plan for sure. It's very exciting.
Yeah.
And hopefully this will help other people, know.
You just never know who you're going to find or where you're going to end up, especially with a condition that we don't know a lot about.
Right.
So I think a lot of people will be able to relate to that who have things going on where the physicians in modern medicine, it's not a run-of-the-mill thing. So sometimes it takes going through a couple of physicians to get to somebody who has the expertise and is willing to try something new, try something different to help somebody. But I think the story or the take-home message there is to not give up.
Right. It took me a long time to get to you and to find you, and that was just part of it. It is not depressing is not the right word, but it's hard when you go to a doctor and they don't know what to do for you.
Right.
And like you did a whole bunch of research and you've educated yourself because you didn't know about it, and
right.
That's amazing in itself. So yeah, you just have to keep plugging at it, and hopefully this will help other people and make other doctors more aware that it's out there, because it's disappointing when you can't find an answer.
Right, absolutely.
Yeah, it's because it's hard to not know what's wrong with you,
right,
and what an answer may or may not be.
Right. And we're so excited. Surgery is next week?
Next
Wednesday. So that's wonderful. Lenore's been in for her pre-op appointment. We've gone over all the details of the surgery, and we're all very excited from the office to be there and experience this journey with her. Facial plastic surgery, regardless if it's functional, insurance, or cosmetic, is a very personal journey. It's a very unique experience, especially in Lenore's case. And we're very excited to be on that whole journey with you.
Thank you.
We have one more exciting surprise for Lenore. She is just arriving at the office, so we're going to go grab her, have her take my seat, introduce herself, and then I'm going to allow her to talk to you about one more surprise.
Hi, my name is Olivia Womack, portrait artist with Olivia Womack Photography, specializing in boudoir and beauty portraits. My passion is photographing women, loving and empowering them through the art of photography here in Central Florida. My gift to you, and being honored to be a part of this experience, is a portrait session after surgery to photograph the new and beautiful you.
That's so amazing. Oh my goodness.
So I just love to love and empower women. So through our beauty portrait session, we will photograph your enhanced beauty.
Thank you so much. Oh my goodness, thank you.
So Olivia, she has her own photography studio, and when she heard about what we were doing with one of our patients, she wanted to be a part of it because her whole thing is women's empowerment, feeling beautiful in your own skin. And we know that all women are beautiful, but she just has the ability to, capture that on such beautiful artwork and photographs. So she wants to do an extra special session with you, considering that you've been through so much with this condition, and capture that extra special spirit that you're going to have after surgery.
It's going to glow.
Thank you. Oh my God, that's so cool.
Hi guys, today is Lenore's surgery day and we're all really excited. The surgical plan is going to consist of essentially a fairly classic approach to a facelift and a neck lift. We'll begin with a small incision underneath her chin. That'll allow us to elevate the skin and evaluate and treat the platysma muscle. We'll also be doing a little bit of liposuction under the chin as well. She has a large fatty deposit in the submental area, the area under the chin, more so on her left side than her right side. So it'll be interesting to see if those fatty deposits related to her genetic condition are amenable to liposuction, or if they're actually dense and firm. From what they feel like, they don't have the same consistency as normal subcutaneous fatty tissue in the neck. So they actually may require surgical excision from the open approach. Her left side behind the ear, she informed us this morning, has actually grown recently within the last week or two, increasing pain, decreased range of motion in her neck. So what I'm a little bit worried about is the fact that this fatty tumor or deposit goes from behind and above the hairline all the way down to her collarbone. So while we'll have an open view of that, there may be some limitation to how much we can remove, but we're going to do our very best to remove as much, if not all of that large deposit that's causing her discomfort. After we address the neck, we'll then turn our attention to an incision around her ear. We'll start by elevating a skin flap, and that'll allow us to directly look at these fatty deposits related to her genetic condition. In front of her ear is another large one. It almost wraps right in front of her ear and down her jawline. The two things that make her surgery a little bit higher risk, a little bit more complicated than a classic aging face procedure are, one, I'm worried that the stretching of the skin from the underlying fatty deposits may have compromised the skin integrity. Number two, I'm concerned that the large fatty deposit has changed the underlying structures, either displacing the normal position of structures and landmarks that we look for when we're doing a facelift procedure, or have they been compromised in some way. Lenore is in the pre-op area right now. Let's go see her.
About 2 months out after my surgery, and everything's going great. My jawline looks amazing, and the recovery went really well, and the scars have healed up fabulous, and there weren't hardly any scars to be seen anyway. Everything's just gone amazing and easy. It's been a lot easier than I thought it was going to be. And I even had a girlfriend at work just 2 days ago ask me told me that I was looking really well, looking really good, and wondered what I'd been doing. And so I told her about the whole deal, and she was very excited for me. Everybody I've told about the experience has been very excited and just amazed at everything that Dr. Archer and Amy have done for me. So it's been a fabulous experience, and I'm extremely happy.